What does health look like for me physically, mentally, emotionally, and work really hard on being good at you.
Healthy mind, healthy body, healthy life. Soul Food on Smooth 98.1.
All right, we're live. Love music, love life. You are welcome to Soul Food right here on Smooth 98.1. Thank you for tuning in and thank you for joining Breakfast in Bed. Yes, my apologies. But we're here now and we're ready to learn about our health. And not just any part of our health. This morning, it's about the eye health. Now, in case you're listening to us for the first time, every Saturday from 8 till 8:30, we dedicate this segment to everything that revolves around your health. Even if we're doing the brain puzzles and teasers and riddles, trust me, it's still helpful towards your health because I've said it before, I'll say it again that mentally stimulating activities are very good for you. So instead of just concentrating on some things that are so pleasurable to the senses, sometimes it's better for you to engage in mentally stimulating activities. Now, on Soul Food, like I mentioned, we are all about educating you about your health and wellness so that you are equipped to take and make better decisions. And so you can join us on YouTube where we're currently live at Smooth 981 FM Lagos, at Smooth 981 FM Lagos. If you're a part of our WhatsApp family, the WhatsApp line to, of course, you already can send your messages if you have any questions or any contribution in the course of the conversation, which we're about to get started. Now, if you do not have that contact saved, I think you should save it. And that will be 0809 444 0981. Again, 0809 444 0981. My name is Oluwaseun, and today we are talking about the frequently asked questions about eye health. The questions that sometimes you see them online, sometimes people tend to ask the optometrist whenever they go to see them or the ophthalmologist whenever they have a session with them, or some things that you're just curious about as touching your eye health. This morning we'll get to answer some of them, some because we know that there might still be some other questions on your mind, and that's why you have the chance to ask it. So let's get right into the conversation. And joining me to discuss this is an optometrist. She is Dr. Ada Mmaduagwu. Good morning.
Hi, good morning, dear. Thank you so much for having me.
Thank you for being here this morning. I appreciate your presence. So let's get right into the questions. I mean, there is no point telling the need to protect our eye health, right? Because the eyes are vital to the body. It's like the light to the body. And so if it's thrown into darkness, it might affect a person's quality of life. So I'm going to start with the basics. Since the eyes are very important to us and our well-being, the question is, what are some of the things that we can do to generally protect our eyes and ensure optimum eye health?
It's very important, as you said, that the eye is the window to the body. And without the eye, you can imagine how your daily activities will be affected. So simple, basic things that you can do to protect your eye health are eating healthy. It's balanced diets rich in vitamin A, C, omega-3, so which you can be gotten from eggs, fish, leafy vegetables, and all. Avoid smoking or reduce the intake of alcohol because this has shown to affect the back of the eye, which is the retina. You can also imbibe wearing sunglasses when you're under the sun or photochromic glasses. This helps protect your eyes from harmful UV radiation and limit screen time. I know it's a digital world now. We're always on our phones, our laptops, and everything. So just limit it, take a screen break and all that. This will help protect your vision. Then the most important is prioritizing your eye examination. Everybody has, you go for routine eye yearly check, but people forget to check their eye. So make it a duty to always include eye checks in your routine yearly examinations. Then this will help protect and your vision generally. These are basic steps you can do to live healthy by protecting your vision. Thank you.
I like how you have given a drone picture of the discussion we're going to have today because you've mentioned the points, not in passing, because I'm going to bring them back. And let's start with the one you said about wearing sunglasses. I know I have heard it, I think, from an ophthalmologist before. Maybe I didn't retain what she said and why it's important. So why is it important to wear sunglasses?
So when you're outside under the sun, there are harmful radiations that go behind the back of the eye, which is the retina. And you might like, what's the retina for? For you to see, the retina is important. And with regular exposure to the harmful radiation, this causes damage to the retina. And the retina is important for you to see. So you can have age-related macular degeneration because on the retina, we have a portion called the macula. And this macula is keen for for clear vision. So with regular exposure to UV light, it damages it and it causes degeneration. So, but when you're outside the sun and you wear protective sunglasses, it helps shade off harmful radiation that can go behind the retina. So that's why it's always important to, when you're under the sun, wear glasses, sunglasses, or photochromic lenses that shade outside the sun. It's very
Now,
important.
about the sunglasses, is there anything, any tip that I need to know in choosing sunglasses or just the littlest blurring of the glasses can help to prevent or protect my eyes?
So my tip for choosing the sunglasses, I have this on my Instagram. The bigger, the better. So it covers, the bigger the sunglasses, the better. When you're going to check, you want to see sunglasses have this tag, 100% UV protection. So you want to make sure it's certified, the good quality and everything. This will help you pick the right sunglasses.
Oh, so in that case, getting sunglasses from those who sell in traffic or by the roadside is not exactly a great option, or it's not doing anything.
So that's why I say you have to check about the quality. So you want to check that is, that's why if you go to good optical shop, you see tags on it,
Mm,
100% UV protection. So you want to make sure, not just random. So the quality out on the street cannot be how will I say, verified. So you have to verify what you're buying to make sure it's doing the right job for you by protecting
mm.
your eyes. Yes.
Speaking about the streets, now this is not about sunglasses, however, it's about glasses. There are people who get their own medicated glasses from roadside hawkers or those small shops by the side of the road. I
Yeah.
know it sounds like it does not make sense, but what are the dangers that are involved in getting your your glasses, your medicated glasses outside of the referral of or the
Okay.
prescription of a
The
specialist?
the dangers are a whole lot because you are in a clinical setting, you have people come in and they're like, oh, I got my reading glasses from the market, but they come in with intraocular pressures as high as 40. And normal pressures of the eyes are meant to be 10 to 21. But because you're visiting the market square to buy this, they don't do the basic eye examination. So you have them either overcorrecting you,
Mm,
undercorrecting you, giving you wrong prescription that even cause more problems. You have headaches, induced headaches because of wrong prescription. So the dangers of getting glasses from street hawkers is very bad. So I advise my patient, please come. You have government hospitals that have subsidized free, even free eye check. Come in, get your right prescription, check your eyes, not just only prescription. Glasses is not only about eye examination is not all about glasses. It's about coming in, we check the vitals, your eyes, the eye pressure, they assess your retina, check whether you have cataract or glaucoma, or even retinal problems like diabetes or hypertension, retinopathies that can cause with associated with diabetes or hypertension. And this is peaks only when you come to check your eyes. So it's important that you should always prioritize your eye health by visiting the optometrist or the ophthalmologist for a proper comprehensive eye check.
Still about the glasses. There are those who say, oh, I don't want to start using glasses because once you start using glasses, that's the end. It's just like hypertensive or pills for hypertension that you have to continue using it all the rest of your life. So one question is, Is this true that once you start using glasses, you have to continue using it for the rest of your life? And two, some say that it worsens their vision over time. Is there any truth to that as well?
So when it's always important that when you come in to the eye clinic, you come in with a concern, and you see people that wear glasses. Their concern is, I can't see. It's blurry. My reading is blurry. My distance is blurry in myopia or short-sightedness, or in presbyopia, which is due to age. When I'm reading at near, when I'm reading my Bible, it's blurry. You already come to the hospital with a concern that you're having blurred vision. So when we correct you by giving you glasses, it's when one, you see better. So if you wear your glasses for presbyopia, that's the need to wear glasses for reading, and yeah, you see better. But when you take it off, you're back to how you came to our eye clinic. I always lay emphasis on that. You come in with a complaint that you already seeing blurred vision at either distance or near. And your complaint, and the whole aim of when you come to the hospital is to treat your complaint, your chief complaint. So you come in and we're like, okay, you need glasses to help you see better, to improve your clarity at distance or near, depending on what we're treating. And if we give you glasses, is when you wear it that you would see clearly. When you take it off, you're back to how your vision is. So the eye is like a ball. And for you to see clearly, images have to be formed behind the retina. But when images are not formed on the retina, that's when you have refractive errors like myopia, hypermetropia, or presbyopia, depending. So the aim of the glasses is to make vision to be formed on the retina. So when you take out your glasses, your vision is formed either front the retina or behind the retina. So that's the whole idea about glass use. So when people say, does it make my vision worse? It doesn't make your vision worse, because as you age, your eye also changes. And when it changes, you need to update your prescription. Your prescription does not change, but your eye is the one that is doing the change. So you need to update your prescription based on your new age. So that's why sometimes you have, oh, your patient comes in, but this glass is not strong enough. I'm like, because your your eyes have changed and your age has increased. And that is why you need an updated prescription. So it's always important to educate, which I always do. Educate my patient. This glasses has to be reviewed 18 months. It has to be reviewed 2 years. And you, before even the patient, before the time comes, the patient will come in like, my glasses is not as clear as. Because it also varies. It might be 18 months for some people. It might even be 12 months for some people because of their lifestyle. Maybe they're always working, they're always doing their work and everything. These factors varies.
Dr. Ada, thank you for that explanation. It's so lucid and so helpful. I'm certain that there is nothing that we can do to prevent aging of the eyes, but will it go back to some of the things you started with in ensuring optimum eye health, as touching some of the things that can help your eyes, maybe slow down the aging of your eye, rod cells, and whatever you have in there?
Yes, yes. That's why I told you about eating well, and those lifestyle changes and healthy habits I mentioned will always help you know what you eat, prioritize your eye health, exercise, avoid smoking, alcohol. Those are things that will help you to reduce age-related changes. Supplements, if you hardly eat right, so you can always incorporate supplements, healthy eye supplements into your diet to help you.
Thank you. Now, in case you're joining us for the first time, you're listening to Soul Food on Smooth 98.1. And this morning, we are talking about your eyes, those windows to the soul, the lights to the body, and why you need to take care of them, and giving education and how to maybe handle situations and what to do about them. If you have any question in your mind, please share with us. Dr. Ada is able and capable. WhatsApp line to send the messages to is 0809 4440981. Again, 0809 4440981. That's the number to send your WhatsApp messages to. Just WhatsApp messages for now. Now let's go back to it. Eye problems and eye conditions, they are hereditary. Some of them are hereditary, right?
Yes, please. Yes, they are. So you have commonly, so if your family member, your sibling, your parents, they have glaucoma, if they have myopia, high myopia, high hyperopia, long-sightedness, or even crossed eye, you are at higher risk of having this eye diseases. So it's always important to come in, check it. And that's why it's always important when a patient comes in and patient says, I have glaucoma, I'll say, please tell your family members, tell your siblings, tell your children, let them come in, because the whole idea about diseases, especially glaucoma, that is a silent eye stella, it's that it shows no symptoms until when it's late. So you have to tell people when you have it. So you help preserve their vision by telling someone that if you have glaucoma, if your father has glaucoma, just come in, check your eyes. What are my pressures? I always tell my clients, please ask questions. You're done. I always tell you, do you have any questions for me? Ask, what's your eye pressure? Is it normal? Is it okay? Why are you even giving me glasses? What you want to ask, you want to know. So it just makes you stay informed about your eye status, eye health status.
I appreciate you for mentioning that eye pressure. You did say something a little about it earlier. I want to bring it back in details. So the eye pressure, as well as the link to the blood pressure of the body, please explain a little about that.
So studies have shown that if you're hypertensive, it could affect your eye pressure. And normal eye pressure is between 10 to 21. And intraocular pressure is a risk factor for glaucoma. Even though there are some type of glaucomas that are normal tension glaucoma, whereby your pressures are normal, but it's causing damage to the back of the eye. But before I start, one will ask, what is glaucoma? Glaucoma is a multifactorial eye disease. But something that we are sure of that leads to glaucoma is high intraocular pressure. I must tell you that I've seen cases where people come into the eye clinic with high pressures as high as 40, 60, and they're not aware. But they came in and we checked. So we have to crash down the pressure, because the longer the pressure is in the eyes, the longer it damages the back of the eye, which is the retina, it leads to the part of the brain that is important for you to see. So when the eye, as I said, the eye is a ball, and what keeps the eye in shape is the pressure. And when the pressure is too high, it causes damage to the back of the eye, which is the optic nerve, which sends images to the brain, a group of wires. And when you come for an eye check, we examine the optic nerve. I will see some signs. I will send you for some further examinations to rule out that you do not have glaucoma. That's why it's always important to prioritize your eye health. Come in, check your eye pressure. Come in routinely, like to check your pressure time to time. And even if you're a glaucoma patient, you need to come in. Don't just stay on your eye drops. Come in for a routine check to make sure that your eye drops are doing what they're meant to do by lowering your eye pressure.
Thank you. Your explanation of hypertension and its link to eye pressure, increased eye pressure, reminds me of my early days of biology. And when they tell you that the body is like a machine with interconnected systems all working together. And so how you maintain one part affects the health or the disorderliness or disease of the other part. So please do take care of yourself in every way. Now, I'll take a WhatsApp message before we continue. Wilson, again, you can join the conversation on WhatsApp. The line to send your messages to is 0809 444 0981. Again, 0809 444 0981. Wilson says, greetings to the guest. Please, I have a question. For someone who has been exposed to the system, I suppose your laptop, your computer, for years, and it's beginning to affect their eyes, how will the person correct it?
So there's something called computer computer vision syndrome or digital eye strain. So it happens when you are exposed to computer for prolonged use. And it's important that when you do this, you have eye fatigue, dryness, blurry vision, headache, even neck, shoulder pain, because you always have in front of your computer. And what you can do, the simple rules I advise computer users are: one, take a break. Your eye is a muscle. And when you are doing near work, it's working over time. So when you take a break, it helps relax your muscles. That is the eye. And the simple tip is the 20-20-20 rule, which says for every for every 20 seconds, look at the 20 feet distance for 20 minutes. This is just helpful to make your eyes relax. So when you're doing a walk, just relax, take your coffee break, then look outside or just with your colleague for a while. This helps to just reduce your. Then you can adjust your screen setting. Proper lighting is important. Then regular eye examination, because studies have shown that near work can induce myopia. So you can even now start having a bit of refractive error. So you always have to make sure that you have the right prescription in case. So in case you're having blurry vision that is associated with myopia, you're corrected. And this will help you. Then you can also use the blue light blocking lenses that help reduce harmful emitted rays from computer and laptops.
To the next one. Oh, by the way, Wilson, I hope this answers your question. So to the next one, which is related, we cannot over discuss this topic, especially as we are in the digital era and so much is going on our screen and in our world digitally. For the children, what are some of the ways we can help them with their eyesight? Because these children, many of them are on their pads, on their tab, on their computers and so on. How do we make sure that we're not damaging their eyesight even from a young age?
So that's why it's always important to make sure you, at a young age and time, 6 months, check their eyes, 3 years, check their eyes, every 2 years before they enter university or before they enter primary school, secondary school, make sure you're checking their eyes. Then also limit screen time. Limiting screen time is important. Then you also have to observe your kids. If they're watching TV, they should not be close to it. Sit them down far 6 feet from the TV. But if you notice that they're always coming close to the TV, this shows signs that they might not be seeing the TV clearly. And kids they will not tell you, oh, mommy, this is not clear. To them, it's like when I'm coming close, I'm seeing the TV clearly. So they want to do that. So you have to observe your kids. If you're noticing that kind of sign, they're saying that they're coming close to the TV, please do so. Book an eye examination with your optometrist to make sure there's no underlying short-sightedness or myopia. Then also give them nutrients that are healthy, veggies and everything. The outdoor time. This is also by limiting screen time, because if you're not doing anything here, the outdoor playing and eye focus, as I said about the relaxing your eyes and everything, distance vision helps relax the eyes. Then also the 2020 rule, but kids will not maintain this
Yeah, I
because they're
understand that.
not. So that's why limiting outdoor activities helps to do that. So avoid screen time before bed, because also this affects their sleep pattern. So avoid screen time before bed. So I think, and also protective blue coats can also, there are kids that wear protective blue coat, because you see most schools now, they're always on their laptop, tabs, doing assignments. So protective eyewears can also help them to protect the kids' eyes.
Thank you. We'll take a breather, and when we come back, we'll ask the question of conjunctivitis, which is known to many as Apollo. What's this thing that seems to come in phases or in seasons, and everybody seems to be contracting it? What exactly is it? How do we prevent it, and so on? We'll talk about that right after this breather. You are listening to Soul Food on Smooth 98.1.
Day has kicked off, and I'm moving through the buzzing city of Lagos. I've got the radio. Collection of Smooth 98.1.
So we're just taking a breather for some seconds, and we'll be back.
All right.
It's the sound of time, the sound of business. From the North Pole to the South Pole, time constantly changes, and so does business. Being an entrepreneur, you've got to be open to the world. For a daily and quick analysis on business headlines, tune in to Business Express on Smooth 98.1 as we track the big stories and walk you through the maze of business policies, how they contribute to the economy and affect your day-to-day financial affairs. And I think that really did shape how I would see the world. Time is business. Business Express on Smooth 98.1 every weekday morning from 6:30. Are your number one temporary radio station.
Thank you for staying with us. We are Smooth 98.1. My name is Oluwaseun Olusegun. It's the 24th of May, 2025. Soul Food is the name of the show, and we are discussing your eye health. Because right here on Soul Food, we discuss everything that relates to your health in every form. So we are talking about frequently asked questions about eye health, and we have answered, more like she has answered a lot of them, and she is Dr. Ada Mmaduagwu. She's an optometrist. And we've had about 24 minutes of clarity on different questions about eye health. In case you're just joining, don't worry, we saved that up for you. So you can find it on YouTube. And if you are joining and you want to retain it or you want to share with someone who you think should be in on this education, WhatsApp, or rather, YouTube is at Smooth 981 FM Lagos, at Smooth 981 FM Lagos. If you're a part of the WhatsApp family, we'll definitely upload the link to the status and you can be a part of it or watch it at your time. Lastly, if you have any question, you can send it to WhatsApp or you can send it to YouTube using the chat box option or the live chat option. The WhatsApp line is 0809 444 0981. Now, before the breather, I promised that we were going to get into the topic of conjunctivitis, which is otherwise known as Apollo. What is this thing that makes one's eyes water and inflamed and red and uncomfortable? And worst part is it just spreads like wildfire.
Yes, Apollo. So Apollo is a type of conjunctivitis, as she said, also known as pink eye. And it is when the white part of your eye is inflamed or infected. So when this happens, it can be due to viral infection, which is commonly known as Apollo. And this one is highly contagious. That's when you can get it from coming in contact with someone or sharing someone's makeup or sharing someone's personal item. But there's also types of other conjunctivitis like bacterial, which is less common, allergic, which is also common because when there's seasonal, when you are allergic to dust, you can always have it. It's almost always related to you itching your eyes, rubbing your eyes. Also, you will also have systemic contributions like sneezing, cold, because you have a general allergic to something. And it's always important that when you have signs like red eye, gritty sensation, thick discharge, and also when you wake up with your eyes stick together and you have light sensitivity, it's important that the eye doctor is your first point of contact for proper management and care. Because you see people falling back to, oh, urine, first breast milk. And I'm like, no, because it causes more complication. So please, in case if you have Apollo, aka pink eye, aka conjunctivitis, please visit your eye clinic. Avoid coming into contact with people, sharing towels, handshake, or limit your hand-eye hygiene. So I think this is a tip on what you can do if you have Apollo, and it's mostly seasonal. It comes with harmattan and it comes with rainy season. So it's always important that kids, when you have your kids having this, please, good hygiene is very, very important. Let them wash their hands, avoid touching their eyes, and sharing personal items like towel and eye makeup.
In your explanation, you mentioned something like milk or, yeah, breast milk in the eyes. What are some of the things that you consider really outrageous, does not even cover it, that you think, no, it just doesn't make any sense? But they were perpetrated as myths, and now people somehow engage in them, but they are dangerous to the eye health.
You have people coming using first breast, like first morning, they say morning urine, breast milk, salt and water, salt and sugar. Funny enough, the last one I saw someone with an eye drop, Jesus eye drop. I'm like, gosh, I swear. I'm like, no, please, and it complicates matters. I'm telling you, I've seen a mother and she put, and it was her child that had the conjunctivitis, he had discharge and everything. The child almost lost his vision because he had a generalized infection of that eye. The discharges were a lot, and we had to He had to take systemic antibiotics, eye drops, and everything. And thank God we saved the person's eye. But a lot of people are not lucky when it comes to when they do harmful practice like instilling breast milk and urine in their eyes, and they lose their sight. So please, if you have Apollo or conjunctivitis, please avoid bad practice because it complicates the eye and it's not good. It's kind of creates a room for bacteria to thrive, or especially in the eye, which is very delicate. So please avoid such behaviors.
Speaking about eye drops, now I don't want you to say, I don't want to say, tell us how they work, but what are some of the things that govern the usage of eye drops? Because there are some people who are permanently on some eye drop, one form or the other. There are some who just have some sort of itching in their eyes and they go on their own to go get some eye drops. What are some of the ways or some of the rules guiding the use of eye drops, and what are they meant to achieve?
Thing is that before you use an eye drop, it should be gotten from a licensed eye doctor, eye surgeon. And you must ask the duration, how long, which eye am I using on? So when an eye drop is given, it must be which eye, duration, for how long is important. So some eye drops are constantly used. So you're a glaucoma patient, your glaucoma treatment is for life. So your doctor will tell you, use so eye drop morning and night at a particular time. It lasts 12 hours. You use second eye drop. So you have to use that constantly because this is lowering your eye pressure. So constant use. Then people have allergies. So people know that when you have allergies, your doctor will prescribe an anti-allergic eye drop, which will help reduce your itchy eyes, teary eyes, and all that. And also another common thing with this weather and also computer use is dry eye. A lot of people have dry eye. So their on eye lubricants are constant because without it, they feel, oh, there's something in my eye, a sandy sensation, tearing because they have severe dry eye. And the severity of dry eye varies. Some people have it mild, some people have it quite severe that they also have to have dry eye supplements to also help with production of natural tears. But my take home on eye drop use is that use eye drop the use of eye drop should be done or prescribed by a licensed ophthalmologist or licensed optometrist. Please do not just randomly abuse eye drop, especially vaccine that is usually abused. Please, you have eye drops should be given for a purpose, for a treatment purpose, and not just abuse. Thank you.
Is dry eyes what's responsible for that feeling of smoke is in my eyes, or I feel like something is stinging my eyes?
What smoke in my eye is the usual sign or symptom for cataract. Now, oh, I'm seeing something smoky that is covering my eyes. And cataract is a normal aging process whereby the normal lenses in the eye, due to age, become opaque. And when this happens, it becomes worse over time, mostly as you age, and it gets to a side that you can't use your eyes and you have to go for surgery. And I always tell my clients that surgery is 90% safe. Like that means it's really good and the success rates are very good. So when you have cataract, please go to the ophthalmologist, do your surgery. But a lot of Nigerians have trust issues. So you have them going around with that. I don't want to do an eye surgery. I'm like, please, you have to because it always affects the two eyes. And when you lose your vision, you have no other option than to do the surgery. And the earlier you do it, the better the prognosis is. So for cloudy vision, it's usually related to cataract.
I'm glad that you unintentionally went to cataract, because when I meant smoke in my eyes, I meant the smoke stinging sensation in my eyes. But let's stay on cataract and the trust issues that many Nigerians have. So what would you give as recommendations to someone who is distrusting of the system for them to pick maybe an eye clinic or the best place for them to have the eye surgery done and know that, yes, don't worry, you'll be fine?
So many reputable eye hospitals and clinics across Nigeria perform safe and successful surgeries. I always tell you don't even need to go leave the shores of Nigeria to have good cataract surgery done. So you just make sure you go to a good eye hospital, government hospitals, teaching hospitals. They perform even eye foundations. There's a very good one in Abuja. They do low cost cataract surgery. And this cataract surgery is also covered by NHIA. So it's under the insurance. So if you're registered, you can do surgery for free. And the key in choosing a licensed experience, the key is usually in choosing a licensed experienced ophthalmologist. And do not delay surgery. Do not delay surgery, because when you fear and delay, it causes like complication, because when it's long standing, we don't know what's happening. But when the consultant tells you, please, it's due time for it. If you go to London, you go to America, it's due time for it and you do the surgery. So please, it's safe and it's very, very successful.
Thank you. On a penultimate note, sometimes you see some people, their eyes are yellow. Other times it's red. What's responsible for that? Hello, Dr. Ada.
I can hear you. Can you hear me?
Yeah. Yes, I can hear you now.
All right, so I was saying yellowish eyes are often pointed to jaundice, which is a liver issue. And when you are commonly in high malaria epidemic areas like Nigeria, but when you have a yellowish eyes, you have to go and do a liver function test before you come to the eye clinic, because it's pointing to you might have a liver infection or disease. So that's for yellowish eyes. And for red eyes, it's usually when maybe you have an inflammation of the white eyes, and it's usually related to conjunctivitis. But it's only when you come to the eye clinic you can say, oh, your red eye is this, because red eye is a very common sign or symptom for a lot of eye diseases. So I can't tell you all this, but when you come to the eye clinic, we do a detailed comprehensive eye check and say, okay, this red eye is this, because glaucoma end stage can also come with red eye. Some diseases, eye disease can come with red eye too. So it's always important that you come in for an eye check yes, ma'am.
I'm a little intrigued about the latter part of your explanation, because there are some people that have known them for a long time and is it the cornea now? It's never been white. It's reddish, brownish.
So most times, because of if you have allergies and you always rub your eyes become brownish. Just I always tell people, if you have severe allergies, and your eyes are itching, you just close your eyes, do a cold compress. Instead of itching, it helps in your eyes and helps relieve you from allergies and allergic reactions by itching your eyes. Because the more you rub your eyes, you might have a yellowish eyes and a kind of eye due to allergies. But the red eye is always complicated because it might be due to inflamed pinguicula. That's a growth on your eye. So if you have a growth on your eye and it's always inflamed, it can always my eyes might always be seen as red. So you have come in and would have to treat that your eyes are not infected or inflamed. So yes.
Finally, what will be the last recommendation, especially as touching checkups and routine activities that you should be involved in? I know you mentioned it when we started, but just in case somebody's tuning in and they need to have an overview of some of the things they need to do in protecting their eyes. Let's talk about the checkup. What's the frequency? How frequently should a person go to check and so on?
Yes, this is a good question. So this is a quick guide. As I earlier mentioned about children. For children, every 6 months, every 3 years, and before they start school, before they start primary school, before they start secondary school, because good eye health is very good for academic performance. And for adults under 40, maybe every 2 years. For adults over 40, every year. But for people with diabetes, hypertension, family history of eye disease, yearly eye examination is advised. But for when you're routinely like glaucoma checkup, you have to stick to your appointment. So if you have an appointment with the eye doctor, with the ophthalmologist, stick to your appointment, because some people have short dated appointment, like every month, coming to check your eye pressure, every 2 months, every 3 months. So please stick to your eye appointment given to you by your professional eye professional. Then I know I've said the quick protective ways or healthy eye habits. So let me just run through it again for people that are just joining in because it's important. The first key on my thing is prioritizing your eye health. Do not neglect eye examination. Prioritize it in your routine yearly eye checks and eat well, balanced diet. Eat well, foods high in vitamin E, C, and omega-3. So you can get them from eggs, fish, and leafy vegetables. Then avoid smoking, avoid drinking alcohol, wear sunglasses. I said it, the bigger, the better, or wear protective eye glasses. Then limit screen time, both for kids and also for digital users by incorporating the 20-20-20 rule, which says for every 20 minutes, look at the 25th distance for 20 seconds. This helps make your eyes relax and reduces eye fatigue, stress, and all that complication. Then protect your eyes. So if you're having like activities, protect by wearing protect protective eyewears that can avoid you from getting eye trauma. And healthy, I must say that healthy I start with healthy habits, which I just literally said it. And your lifestyle directly affects your eyes. So
Thank you. I couldn't have asked for a better optometrist to discuss this with. I'm grateful for your presence this morning. And thank you for taking time out of your schedule because I know you have a lot going on this morning. If people want to catch up with you and know more about what it is that they need to do and what you do, what are your social media handles?
so you can follow me on all social medias at Instagram, Twitter, Facebook at Ask Dr. Ada. So that's ASKDRADA. Ask Dr. Ada. So I'm always there, a DM away for all eye care related questions and concerns. So, because it's something I do, it's something I'm passionate about because your eyes serve you every day and returning the favor by taking care of them because your vision is very priceless. So yes, please. I'm always a DM away. Please ask your question. And thank you so much for having me.
It's a pleasure. And that's it for today on Soul Food. Again, remember that you can go back to our YouTube channel to catch up on what you have missed or share with someone who you think will benefit from this education. And that will be at Smooth 981 FM Lagos, at Smooth 981 FM Lagos. Next week, we'll return, and you know it will be the last Saturday. So it means we're going to be having a fun time with brain puzzles. But Breakfast in Bed continues because 9 o'clock, we're going to have a delightful conversation. You know, on Smooth Explorer, it's about entertainment, music, and discussions that entertain and inform you as well. So you'd have to stick around to find out what I have lined up for you. My name is Oluwaseun Olusegun, and this is Smooth 98.1. Thank you, Dr. Ada. I enjoyed every part of it. Thank you.
Thank you so much. Thank you so much. Thank you. I appreciate it. Have a lovely weekend ahead. Restful weekend too.